Hold on to your hats, folks, because the world of home healthcare is in for a shake-up. The Centers for Medicare and Medicaid Services, or CMS, has proposed a decrease in payments for home healthcare services starting in 2025. Yes, you heard that right, a decrease. Now, before you panic, let's break down what this means and why it's happening. We'll explore the potential impact on both patients and those working tirelessly in the home healthcare field. Get ready for a wild ride through the ins and outs of this complex issue. Don't worry, we'll try to make it as painless as possible. After all, laughter is the best medicine, right? Especially when faced with potential cuts to essential healthcare services. So, buckle up and get ready to learn everything you need to know about this important topic. You might be wondering why CMS is proposing these changes. Well, it's a bit of a numbers game. CMS uses a complex formula to determine payment rates, taking into account factors like inflation, market trends, and even how efficiently healthcare providers are operating.
One key factor is the market basket update, which basically reflects the rising costs of goods and services. Think of it like your weekly grocery bill. The prices of things tend to go up over time, and home healthcare is no exception.
However, CMS is also factoring in something called behavioral adjustments. This basically means they're trying to account for changes in how home healthcare is being delivered and how patients are utilizing these services. It's all a bit complicated, but the bottom line is that CMS believes adjustments are needed to ensure the long-term sustainability of the Medicare program. So how will these proposed changes impact the home healthcare industry? Well, agencies will need to adapt to a new financial reality. With potentially lower reimbursements, they'll need to find ways to become even more efficient with their operations without compromising the quality of care they provide.
This could mean streamlining administrative processes, embracing new technologies, and finding creative ways to do more with less, which is no small feat. It's a challenge for sure, but one that home health agencies are up to.
On top of that, CMS is introducing new quality measures and value-based purchasing models. This means that agencies will be rewarded for providing high-quality care that leads to better patient outcomes. It's a shift from simply paying for services to paying for performance, a trend we're seeing across the entire healthcare system today.
Now you might be thinking, that's all well and good for the home healthcare industry, but what about me?
That's a fair question. The good news is that CMS is committed to ensuring that Medicare beneficiaries continue to have access to the home healthcare services they need.
However, it's possible that these changes could lead to longer wait times for some patients, or make it more.
It's also possible that some agencies, particularly smaller ones, might struggle to adapt to the new payment environment, potentially leading to closures or consolidations.
It's important for patients and families to stay informed about these changes and to advocate for their healthcare needs. Talk to your doctor, research your options, and don't be afraid to speak up if you have concerns.